Good afternoon. I think we'll start now because we're a few minutes after 2 o'clock. Welcome everybody to our session entitled When Your Child Has Had a Stroke. I've got 4 panelists hopefully to speak to you today. One lady is having some technical difficulties, so hopefully Becca will just pop up at some point when she's got her laptop sorted out. So fingers crossed for that. In the meantime, I'd like to introduce myself. My name is Genise and I work for Different Strokes. Primarily my job involves peer support, supporting everybody from all ages, but I have a particular interest in children and young people. The seminar this afternoon is part of a week of webinars that Different Strokes is showing this week, every morning at 10 o'clock in the morning and every afternoon at 2. And we'd really like to thank our sponsors, Bolt, Burden and Kemp, for their support with this. Today's session will focus on childhood stroke, and the 4 people that we have to speak to you are Rebecca, who her son Jacob had a stroke while he was in utero. We have Katie, who was 6 years old when she had her stroke. We have Renee, who is the mother of Ollie. He had 2 strokes, one when he was 13 and another when he was 14. And then we have Ailey, who was 21 when she had her stroke. Just a little bit of housekeeping for you all. The session is being recorded, but the only people that will be recorded and shown are the panelists. So none of the attendees will be recorded. Please can I also draw your attention to the bottom of the screen, where you can see a question and answer icon. So if you've got any questions for the panel, please do feel free to pop any questions that you may have in there, and we shall ask questions at the end of the sessions. And the other function is the chat function, which you can just chat amongst the other attendees in that box. And I think that is it. I think we're all ready to go. We're going to start with Katie, and I'll let Katie take over from now.
Great. Thank you. I can unmute myself. Hi, so I'm Katie. I
can't hear Katie.
I shouldn't be on mute. Hold on. Can you hear me?
You can all hear Katie, but I can't.
That's all right then, as long as someone can hear me. So I'm sorry if I get interrupted today, guys. I've got a poorly child at home, which I had to rush off and pick up from school. So if we get any interruptions, that should be him. Lovely. So I just wanted to tell you a bit about my first-hand experience of having a stroke. I think the Stroke Association says that 400 children and babies a year have a stroke, and I was one of them. So this is 27 years ago. I was 6 years old, and I had, on that day, had all your classic stroke symptoms. I had the drooped face, I had the clumsy coordination, excuse me, sorry. I had the clumsy coordination, and I couldn't speak. I was basically all the classic stroke symptoms, and no one really diagnosed it until the next day, which was quite unfortunate. I think I wasn't even told to go to hospital in an ambulance. I think my mum just took me there. And so I think that time, 27 years ago, there was quite, I'd say childhood stroke is really underrepresented now, but even more so then. yeah, so I had a CT scan the next day, which sort of showed that I had multiple clots in my brain, which I hadn't found out until recently. So that left me with left-sided weakness, basically, so all down my left side. And then following on from that, I developed chronic spasticity in my left side. So that meant from all these sort of multiple clots when I was a child, I spent about 6 weeks in Great Ormond Street in London, I think. And I had to learn to walk again. I had to learn to talk again, really. I couldn't speak very well. All that I was kind of reset to infancy, I suppose. I mean, I had most of my brain function worked, but it's just a physical act of being able to, speak and walk, those kind of things. I was lucky that I was still managed to keep, I had a lot of damage in my brain, but still managed to keep quite a lot of intellectual function. But yeah, so I guess, so I was in a wheelchair for quite a long time. When I went back to school a term later, I sort of managed in a wheelchair with lots of people helping me. I had lots as a child, I had lots of rehab. I had physio every week at school. I had hydrotherapy. I had orthotics. I wore splints, that kind of thing. And that seemed to fall off the wagon as I got as an adult, but I was sort of managed to get to a level where I could function just using one side of my body. So yeah, I am here now as a disabled adult. I don't have a very good function of my left side of my body. I still have walking difficulties and just chronic spasticity. It's actually really painful. But saying that, I work 4 days a week now. I have 2 children. I function as I am at the moment. And I guess it's interesting speaking. I hadn't met another disabled person until I started getting involved with, another stroke survivor, until I started getting involved with different strokes, and hadn't realised that so many of these symptoms that I grew up with were stroke related. I thought, I didn't realise that my struggles with speech were to do with the brain damage. I didn't realise that my fatigue levels were to do with the brain damage. I didn't realise that my brain fog, which I get all the time, is all sort of to do with that. So by connecting with different strokes, I found that really helpful to identify really as a stroke survivor. I think there's really not much awareness of stroke in children, hence why I wasn't diagnosed. I've always been this medical mystery to everybody that I meet, even if they're doctors or nurses. It's always been that deep dive into what happened and why. And I don't think nobody has said, nobody has said that they know someone else that it's happened to. It's always been quite like an isolating experience. So I guess I was just so pleased when I met everybody here and I realised it had happened to somebody else and that it wasn't just me. And I guess I wish that was on a wider level, that people understood and they took the time to understand. I just wonder just take a minute to see what else I can say. As I said, the main things that affect me now, I think I've got used to living with the physical effects of my stroke. So I still have spasticity, but what mostly affects me now is the fatigue and the brain fog. I think that the fatigue has robbed quite a lot of time of my life. Like as I get older, I spend much more time resting, much more time in bed. And that might be a consequence of having 2 small children, but it's definitely getting more progressive as I get older. So I think I had that sort of teenage, early 20s sort of best time of my physical ability. And I'm sort of seeing the end of that now. Not the end of it, that sounds really, really morbid. But I'm definitely struggling slightly more. So yeah, I guess I just wanted to sort of portray to everybody that although I think my damage in my brain still carried on into adulthood, like this is, it's not a horror story. Like you have a childhood stroke, it's not the end of the world. I've still got well-rounded life. I've still got the most amazing children who are the most hard work, wonderful things. I've still managed to carry on doing quite a lot of things in my life. So yeah, there I am. I don't know if anybody's got any questions in the chat or anything. But I think that's all about it for me.
So far, Katie.
I don't know.
Okay, thank you. Anything else you wanted to say?
Oh, sorry, I did have one whole point at the end I was going to say is moving from a child to an adult. I think what I've seen in just being a disabled adult is that the social model of disability has come into it so much that growing up, I thought that I was the problem. I thought that it was my disability, that, you know, I wasn't the same as my friends. I wasn't, that it was me that's stopping myself being able to do stuff. And actually, as an adult, I've been able to see that actually society isn't built for that aren't able-bodied. And that's so, like, that mindset has changed my life. Actually, it's not me, it's the fact that I can't get into, you know, if I'm in my mobility scooter, then I can't get into restaurants and shops and stuff, and that's actually not a reflection on me. So I think if anyone is experiencing stroke or childhood stroke, that's a really important, I wish I'd known that when I was younger. I wish I'd just known that it's not you, it's just the society isn't built for people that are slightly different, and that's a bit sad. But yeah, I feel a lot healthier in my mind knowing that there are ways around things that you just need to, unfortunately, you have to ask them, and that's quite difficult.
Yeah. Okay, thank you very much, Katie. That was lovely. Now I'd like to introduce Becca to you all. Becca had a baby who was born after already having had a stroke. So all yours now, Rebecca.
Hi. So yeah, my name's Rebecca. Sorry, I'm having a little bit of audio trouble. I think it's okay now though. I had my son when I was 17, and he was born under the presumption that he was going to be a healthy baby. There would be no kind of barriers in the way. Unfortunately, I did have a rather difficult birth though. The labour wasn't ideal, and there was a lot of complications that came along with it, which resulted in an emergency C-section. So it was about, I would say, a couple of, like, maybe 14 hours after he was born, he started having seizures. And originally they did suspect that the seizures were caused by an infection in his respiratory system, just due to the nature of the birth. And then after that, after he had run tests and he had been incubated and had strings of antibiotics and stuff, they sent us away and they sent us for further tests, which included an MRI. And I think he was about 3 months old, and we found out that he'd had a stroke. And the stroke was said to have basically completely taken away all of his walking abilities, his talking abilities, his fine motor skills, his abilities to connect with people. They said that he would probably never walk and he would probably never talk, and that he would almost certainly be destined to stay in a wheelchair and he would never be able to communicate with us. But and that was really hard to find out, especially when you're 17 and you don't really expect these kind of things. And I didn't know that babies and children could really have strokes, let alone know that they could have strokes whilst they were still in the uterus. And but they kind of say things like, oh, but that might not happen, and you know, he might not, all of these things that we're saying might not be what actually happens, and he could be fine. And to mostly surprising factors, that was the case. He got there with walking, and he is still quite a little bit difficult on talking. He can communicate with people. He still has the odd times where talking can be something difficult for him, and he needs a lot of speech therapy. We've had speech therapy pretty much since he was a baby now. And I don't think that's going to be something that goes away anytime soon, possibly ever. But he's definitely a lot further advanced than they had originally told us he would be. And walking wise, he still does have a little bit difficulty walking. He has a little bit of, you know, if we go for long walks, he needs a lot of breaks. He needs a lot of time to adjust. For a really long time, he did still have to use mobility aids, but he's getting there with that too. The only thing that is kind of a lasting effect that we think will be a forever effect as well as his progressing through the school system. He is currently at this stage 2 years behind where he should be in terms of year groups. He also has to be in the EMP base, which is an educational enhanced base, where they kind of have a mix of children who all have different learning abilities and different struggles with school. And he is coming along really well in there, but as currently he's still in technically year 1, whereas at his age he should be in year 3, I think. So that is quite difficult, and especially when you consider how he has, you know, he has emotions. He is an emotional child. He leads with his emotions, and he leads with his heart, kind of thing. And that can also be really difficult though, because he does tend to get really, really angry at a lot of things. And it's just because he doesn't understand what's happening in his own head, and it can be a lot for him, and it is really difficult sometimes to watch as he's trying to figure out, like, why can't I do this like the other children, and why am I not able to join my friends in the next year group. So that's quite difficult. But I think as he gets older and we can talk to him more about it and try and explain more to him, like, this is why things are the way they are, I think that might be something that he can understand. But at the age of 7, I don't think it's something that he fully grasps the concept of, because all he really knows is that he's spent his whole life in and out of hospital. He's spent his whole life constantly under observations, constantly under supervision from pediatricians, from physiotherapists, and it has been a lot for him. But I think as a 7-year-old, you know, he takes it like a champ. He's a very boisterous boy, and he just loves things that typical 7-year-olds love. Like, he loves to game and he loves silly toys like Transformers and stuff. He just loves things that are like, you know, everything what another child loves. But then he does have this extra level of, well, I don't understand why I find something more difficult than somebody else my age. But I hope in time that that's something that we can work on, and that when he gets older, he'll say, well, I know now why I'm not quite with the other children. But as far as he is aware, I don't think he thinks he's too different to the other children right now. I think he tends to feel quite accepted. I think sometimes he doesn't understand why he finds it difficult to make friends, because his communication isn't the best. But I do think that when he does make friends, he makes really good friends who are really accepting. So that's like a really reassuring thing for the family and for him himself. And yeah, I think that's pretty much everything. He's just, for a 7-year-old, going from a baby who had had a stroke, where they basically said he would have no chance of basically ever being able to do anything, to a 7-year-old who can do pretty much everything, just a little bit delayed, is what you can really hope for.
Yeah. Oh, thank you very much, Rebecca, for sharing your story. Thank you very much.
Thank you.
And now I'd like to introduce Renee, and she will tell us about her story of her son who was, I can't remember, you said 13, didn't you? 13 and 14.
Yeah, thank you, Genise. I'm going to do it through a presentation. I haven't had a stroke, but I've got MS, so I've got neurological brain fog as well, and I find using presentation helps me to remember what I'm supposed to be talking about. So,
Okay.
Can you all see that okay?
Yes, yeah.
Brilliant. So this is my son Ollie on the left, and his older brother Ben. Just to jump to the end, this is Ollie now, so you can see he's fine. Hopefully I'm going to give you quite a positive story here. So Ollie was 13. We're a Jewish family, not particularly religious, but quite traditional. So he had a very big bar mitzvah, a big party, and that is to celebrate a boy becoming a man. So at 13, we were all thinking, oh, you know, what's ahead for Ollie? What's his manhood going to be like? And within a year, he had his stroke. And suddenly everything changed, and we suddenly found that Ollie was pretty much living here for a few months in the London hospital, and his life changed, and suddenly it was all MRIs, injecting himself in the tummy, learning how to manage his warfarin by giving himself blood tests on his fingers, hospital tests, that was an angiogram he had, and a different kind of schooling because he was suddenly going to school in the hospital. And he celebrated his 14th birthday in the hospital, so very different to the year before. That's not a cake I made, by the way, that's a stock. So I just want to shout out a couple of charities here. The Sick Children's Trust, I don't know if you've heard of them, but they were amazing. They provide houses close to hospitals. And so I was living in Whitechapel for a couple of months, and it meant I didn't have to worry about the journey time to see Ollie. I was with him all the time. I was, you know, right there on hand. And if he was ill in the night, they would come and get me, which fortunately didn't happen. But it's an amazing charity. So he came out of hospital and we went to lunch, one of our first outings with my parents. We were in Epping, it's a little town in Essex. And as we were walking along the street, Ollie had another stroke. And I saw it, and it was the traditional face dropping. He couldn't raise his arm, he couldn't speak, he was dribbling. So we were taken to Harlow Hospital and then transferred here to Great Ormond Street, where we lived for another few weeks. This is the only photo I have of that time. It's with his brother in the check shirt and my nieces and nephews. But you can see Ollie coped really well, despite all the testing and everything that he had. He was getting on well there, fortunately. This is the other charity I want to tell you about. It's called the Dream Factory. It's quite a local charity to us in Essex, but they were amazing because they provide dreams for children who are sick. And they gave Ollie an Xbox, which like a PlayStation sort of thing, which was amazing for him because his friends were all 14 and turning 15 and going up to London and doing things on their own. And I was keeping Ollie completely wrapped in cotton wool. He wasn't allowed to do anything. And it meant that his friends would come round and they'd stay all day and all evening playing on the Xbox. So I'm very, very grateful to this charity for providing that. And we do what we can to support them now. So this was a couple of years ago when we were collecting at Christmas. So Ollie went back to school. His friends were absolutely brilliant, and so were the staff. The Senko was the deputy head, and every child in that school knew about stroke. They knew what can cause it, they knew symptoms, they knew how to recognise it. Ollie had some lessons cut, so he didn't do a full curriculum. And he also did shorter hours, I think, so that he missed the rush of going to and from school. If he needed to go to the loo, someone always knew where he was. He really benefited from having that buddy system, and it meant we didn't have to worry. So around that time, I decided to have a look on Facebook and see if there was anybody else whose child had had a stroke. I'd made a couple of fabulous friends already, Nancy and Liz, and I thought there must be more than just the three of us. So I started the group on Facebook. It's now got almost 900 members, and I will talk about that a little bit more before the end. Also became very involved with the Stroke Association. There was a steering group quite early on, and the friends I've mentioned, Liz and Nancy, were part of that. Also a really, really fabulous lady called Carol. If any of you have children with sickle cell, Carol set up a charity for children with sickle cell who then had strokes. And very, very sadly, she passed away from COVID earlier this year. But what we did on the steering group, we were working with people from the Stroke Association and also some medical professionals. And so many things were achieved through that, helping to set policy around treating children with strokes, making sure that the website was more accessible to people and had the right information, creating resources. These, just to stress, these are not things that I personally did, but may have been involved in, but all this group together, this is what everyone did. The resources are all available on the website there. Recruiting a childhood stroke coordinator, and there's actually somebody new starting in that post next month. Liz and Nancy were very involved in clinical guidelines, which was a huge document that's gone out to all hospitals so that the staff there recognise a stroke in a child more quickly. And there are set guidelines for what they should do, how quickly they should have MRIs and CT scans and that sort of thing. The coordinator also did a toolkit for schools, which was really good and very useful. So they're all things that are still available now. Nancy worked with ambulance crews, first responders, so that they could recognise a stroke in children. And also we created some parent support days, and I met Genise at one of those. And I think they'll be coming again in the future, maybe virtually at first. So lots of things we got involved with. Ollie, he's still there, I think, on the Stroke Association website, a bit hidden away, but you can find him. But he was talking about his stroke quite early on. He also spoke at a conference, a London conference, and I really wish there was a copy of this because I was so proud of him that day. And I remember going up to London with him on the train, and I said to him, would you like me to read through your speech? And he said, oh, I haven't written one. And I was thinking, oh my goodness, but he spoke off the cuff and he was so engaging. I really was very proud of him. We've also been to the Houses of Parliament. Ollie and I didn't speak there, but it was to support another child who was there to speak. And it was with the Stroke Association. They do a lot of work lobbying Parliament. I know this is a question that came up before today's conference. So they are lobbying Parliament. There are members of the team there whose job is to lobby Parliament, and childhood stroke is something that they do feel very strongly about. Ollie and I both spoke on the radio a couple of times. He's brilliant. I was rubbish because both times I became a bit overwhelmed and emotional. So that wasn't great, but it gave people a taste of actually how it is to be the mother of a child who's had a stroke. I also was on Breakfast TV. I was with a doctor named Dr. Anne Gordon, who is from the Evelina. She was brilliant. I didn't say an awful lot, but it was fantastic to help raise awareness of childhood stroke. And I was very, very proud to have got a certificate in recognition from the Stroke Association, and even prouder and very humbled that we actually won an award. And the Stroke Association have put us forward for this. It's an Inspirational Woman Award from Gloria Honeyford, and it was the category of Inspirational Mother and Son. We really were happy to get that. So Ollie recovered really well. He did well at school and he went off to university. I was a nervous wreck when he went to visit him often. There he is with grandparents. And then one day, they do this thing at Cambridge where the students have 24 hours to get as far away from university as they can. And I knew Ollie was doing it, and I thought he'd probably go to maybe Leeds or Manchester. And suddenly I got this photo WhatsApped to me. He was in Athens. And the message was, "Don't worry, Mum, I wore flight socks." Because that is my big thing with him, because his stroke was caused by a clot. So that was funny. He graduated, he did really well. And he went off to live in Dubai for 2 years, which again, I think I would be proud of every achievement, however small. This was a huge one, and it showed that he'd overcome the stroke, although it's always a worry, more so for me than him. But every day I count my lucky stars. I've got 2 messages that I want to give you, and this is the first one. Take care of yourself. When he had the stroke, people said to me, talk to someone, get counselling, just chat to a therapist. And I said, I don't need that. I'm a strong woman. I don't need counselling. And I just powered through and set up the group and did all the things that I've just told you about. And then a couple of years ago, Oliver was at a nightclub in Camden Town and he was drugged. He was drugged and mugged with a date rape pill. Fortunately, he wasn't badly injured, but he got home at 4 o'clock in the morning, covered in blood, and he'd been sick. And he was incoherent, and I thought he'd had a stroke. And to cut that story short, in my brain, I went right back to 2009 and all the things that were building up inside me over the years poured out. And I just kind of had a mini breakdown. And I had to have cognitive behavioural therapy to get my brain to understand that was then and this is now. And he hasn't had another stroke and, you know, everything's okay. But I touch wood all the time and thank my lucky stars all the time. But do look after yourselves. So that was the first message. My second one is, if you're not a member of my Facebook group, please do come and join. I asked for some comments here to pass to you, and people said lovely things. This is why they like to be in the group. It's very positive. They feel that they're not judged. Other people understand. You can read about other people's experiences, get lots of help, lots of support, be inspired by the tiniest things. You know, if a child learns to do a button, that's a really big deal, and it's nice to be able to share that with people who understand that it's a big deal. So do come and join us, and thank you for listening to our story.
Thank you so much, Renee. That was fabulous. Thank you for sharing your story with us.
Pleasure. Thank you.
Thank you, and all the hints and tips, which I'm sure if anybody wants any more information, just let us know and we can forward you all the websites that Renee mentioned earlier. Thank you very much.
Thank you.
Thank you very much. Now, last but not least, we've got Ailey. And welcome, Ailey. Ailey was 21 when she had her stroke. I'll let you tell us what happened to you. Thank you.
Thank you. Yeah, I'm Ailey. I'm 24 now. I had my stroke at 21. It was an ischemic stroke, so caused by a blood clot. Very unexpected. I was actually on holiday at the time, celebrating my 21st birthday in Iceland. I didn't have any of the typical fast symptoms. It was my eyes that I lost control of. And then before I could say anything to my partner that I was with, I completely lost consciousness. So obviously an ambulance was called. They checked everything, you know, my blood pressure, that was fine. They couldn't work it out. I was in, I don't know if you're familiar with the Glasgow coma scale, but I was ranked a 4, so almost completely comatose. I was taken in, lots of scans, put into the ICU unit at the local hospital. Once they diagnosed it with stroke, I got the thrombolysis treatment to dissolve the clot. And I think it was about 4 hours after I regained consciousness. They were all very worried about the sort of impact it was going to have, and no one was really sure what was going to happen when I woke up. But thankfully, I hadn't lost my memory. I could still read and write and speak, which was the biggest concerns. So they obviously got in there quick enough with the treatment before too much damage was caused. So it was mainly cognitive damage. There was some muscle weakness, but it was mostly my processing, my concentration, short-term memory, and visual problems that I suffered with. And then the big one, the fatigue, had the biggest impact. So yeah, it was quite a struggle. My whole life had been turned upside down just all of a sudden. And I'd never really heard of anyone having a stroke at my age, and I didn't know anyone that had really been through anything like that. So it was quite an isolating experience. I had to withdraw from my course at college, and I had to get signed off of work. And after 6 months, I decided to go back and do a phased return with amended duties, which was really difficult, but I'm really glad I did it because it helped me get back out there and build up my confidence. And you know, we all talk about the sort of main symptoms of a stroke, like I just kind of discussed my cognitive ones, but there's also the sort of social impacts and the anxiety and things like that. So it was quite a big thing getting back out there afterwards. So I did that for a while, built everything back up at work. And then it was 18 months after the stroke that I decided to go back to college and finish the rest of my course. So I did manage, and thankfully, because I'd completed about just over half the year, I only had about half the course to do. So obviously it wasn't completely full time, which definitely helped. And then now I am working full time and have been for the last year, full time plus overtime really. So yeah, there is hope, and I would say I kind of live a mostly normal life now. Fatigue is still an issue that I have to deal with. But as long as I get plenty sleep, I would say I can sort of live a normal day now, and kind of keep up with all my friends again. So that's good. There is hope there. And in terms of the cause, it was a hole in my heart. So I've had that since birth, but we didn't know about it. They found that it took a few months because obviously I was in Iceland when it happened. I was discharged so I could come home. So then all the investigation was done as outpatient procedures. And it was quite a slow process. But it was a year after the stroke that I managed to get the PFO closed with a small device, which I didn't have to do, sort of an optional thing, but for my own peace of mind, just to reduce the risk of another stroke. So yeah, definitely saw kind of decrease in anxiety. Once I had that done, I kind of didn't feel like it could happen again, touch wood, after that. So that was definitely reassuring. And for the rest of the recovery, it was, I would say, a big thanks I owe to Chest, Heart and Stroke Scotland. Like I say, because I was sort of discharged from Iceland and had to do a lot of it as outpatients here, I didn't really have much dealings with doctors apart from investigating the cause itself. So I felt like I was just left to figure it out myself. But there was a stroke nurse who was based in the hospital. I saw her regularly, and she talked me through it all, told me what to expect, and gave me an idea. And obviously they can't promise anything, but she really helped me talk through it and set me up with physical therapy and occupational therapy. which was really helpful. And that was where I met someone who hadn't had a stroke, but it was, can't remember exactly, it was some kind of illness that has very similar effects as a stroke. So we got paired up for physical therapy, and that was really nice. And that was my sort of only experience of someone my own age in all of the kind of recovery sort of things that I was going through. So that really helped, having that kind of peer support and not feeling like I was, like 40 years younger than everyone else and they're all looking at me like, why are you here? I even had a lot of them kind of comment and say, or are you just a student doing research? Is that all you're here for? So it was nice to have someone that you could relate to and understood what you were going through, because obviously it is kind of different going through a stroke at a younger age compared to older. My studying and work life and everything was all thrown into the air. So having people that understood that was really important. And that was kind of when I then looked into more things, and my stroke nurse had mentioned different strokes. And I reached out, joined the Facebook group and things, and suddenly realised there was actually a lot of us, which was reassuring. And then I felt like there was just a lack of support, sort of where I am, at least, for younger people specifically. So I definitely wanted to get involved. And about 2 years ago, I think it was now, Different Strokes reached out with a new peer support for 16 to 25-year-olds. So I've been involved with that. And for the last 18 months or so, I've been doing calls with some other young people that have had strokes. There's one girl I've been speaking to long term, had her stroke when she was 16, and she's been navigating through college and things as well. So it's really nice to speak to someone going through the same sort of things, and you can just sort of share experiences and offer support and advice, but also sometimes it's just a listening ear, similar to Renee's Facebook group, probably just speaking to people who actually appreciate the achievements and the struggles, and you don't have to kind of explain yourself to. And every time she speaks about it, I understand. And it's something I kind of wish I had going through mine, but I'm very, very glad to be a part of it now. I really enjoy it. And even though I kind of consider myself mostly recovered, with just a few small issues that I still suffer with, it's still nice to speak to someone and know, oh yeah, I went through that. And it's the same for you, you understand. And yeah, it's just nice to know you're not alone. And yeah, it means a lot to be a part of it. And yeah, I'm happy to be a part of this and speak. And if there was anyone who ever wanted to reach out and kind of ask any questions, maybe about the college side of it, if it's people that have a child who's studying now that's had their stroke, or point them in the direction of the peer support if they were old enough, we'd love to help them. I think maybe a few things I've learned, I think, that helped me with recovery was, there's one quote I heard, if something's worth doing well, it's worth doing poorly, which I kind of didn't understand at first. But the idea is basically, if it's worth doing something properly, it's also worth doing it kind of halfway, if that's all you can manage. And, going out there, you don't need to go to the party and stay the whole time, or you don't need to do school full time. If you can only do part time, it's better than nothing. And, it doesn't need to be all or nothing, just kind of get out there and do something. And it's very important for the people around you to support you through that. So as parents, if you're supporting your children and let them know even a bit is better than nothing. And before you know it, they'll be doing plenty, like Renee's son, all over the world. But yeah, I think that's everything, unless anyone has any questions.
That's fantastic. Thank you, Ailey. That's brilliant. Thank you very much. You've done my job for me, mentioning the befriending service.
Yeah.
Thank you. I think we do have some questions. One was asked before the webinar, and that was problems with a little one who is having sleep problems post-stroke. I was wondering if anybody on the panel would like to take that one. I think I'm kind of looking at Becca. Becca's got, could you unmute, Becca?
Yeah, I did actually write down a reply to this one when it came through the emails to us, because it is something that, even though I'm not a professional, I can't say professionally if that is, you know, something that happens. It is a lived experience that I did have with my son. You know, obviously a baby, typical, you can't get any sleep with them. They're going to be up all night feeding, etc., etc. But we noticed about when Jacob was getting to the age where you would typically expect a young baby, toddler, child to start sleeping through the night and start kind of coming out of that, you know, I'm awake all night routine. Jacob just wouldn't. It didn't matter, you know, I don't consider myself as someone who's sleep trained. I just consider myself as someone who was, you know, kind of worked with the child. Like, if you're tired, you need to have a nap, and if you're not tired, you know, we'll just lie down and see if we can get some sleep. And I would find often that I would just have nights of no sleep. And if we did, it would be until at max 2 o'clock in the morning, and then it would be up with the rest of the night, with the odd nap kind of strewn in there. And I would find that he would just find restlessness in every sleeping situation. It didn't matter how, you know, tired he was, he just would not, because with children, you can see it in the face, in the eyes, in the behaviour. When they're tired, they are tired. And when they're overtired, they're really overtired. And I would just find that, you know, for a good up until 4, 5 years old, it was just endless nights awake. And especially after I had my daughter, his little sister, I found that he also was still, like, more so, if anything, wanting to be awake a lot of the hours through the night. But it did start slowing down a little bit. He started to come out of that kind of place where like no sleep, just full power all the time. And now he is really good at, you know, if I say it's bedtime now, he'll go to bed. But I do find that I'm up at least 5, 6 times through the night with him. He's either, you know, he wakes up, and it doesn't seem to always be particularly for a reason. Sometimes it's to go to the bathroom. Sometimes he wants a drink, as children do. But sometimes I do find he just wakes up and he comes in my room and he stands there, and it's almost like he's not awake. He's not sleepwalking, but he's not awake because he's talking and he's communicating, and he knows what he's doing, but he doesn't like cooperate properly. He kind of goes all fuzzy and then he starts crying. So I think that is something that, you know, I will put it down to it being part of his stroke, just the behaviour around sleep. Like I said, I'm not a professional, so, and I've never fully looked into it or had anyone explain it to me, but it's something that you can definitely say, like, this, you know, it's not something that every child does. So you've got to kind of think, well, it could very well be the stroke, and sleep is just going to be something that we struggle with for a while. And for as long as we struggle with it, we struggle with it. But I mean, it's not like we don't get any sleep now, but he is still a little bit away with it, but he is getting a little bit better. So I think it does get better. Once they come out of the toddler stages, I think it does get better. Maybe it's not instantly, but over time.
Thank you. Renee, I think you had some, could you unmute, please, Renee?
So I asked the question in the group, and a couple of people gave some quite comprehensive answers, which was brilliant. And they said that the sleep disturbances could be for a number of reasons. Leg cramps, getting stuck in one position, sleepwalking or sleep talking, as Becca, as you've referred to. And some of the things that they said they used to overcome it, some of the strategies, are things like giving the children massages to help with muscle cramps, a heated beanbag which I'd never heard of before, but I have heard of a heavy blanket. So I don't know if, you know, perhaps just the weight on a child, extra weight makes them feel more comfortable and more secure. I don't know that, I'm guessing. Taking naps during the day, if a child seems to be tired, letting them have a sleep. Having a relaxing, calming bedtime routine, which I guess is good practice for any child. And the final thing they said is to not wake up a sleepwalking child. If a child is sleepwalking, not to wake them. So that's some feedback I had from the group. So you can see if you ask a question in there, there's always somebody that's got an answer.
That's brilliant. Thank you. Somebody today has asked for tips for best supporting a loved one, child with fatigue. Is anybody like to?
I think just from a bit of my own experience, I think teaching them about their fatigue is such, I wish I was taught that. I didn't know that that's what it was and that it was okay. And teaching them about pacing themselves, and actually that it's okay that at some point you're going to have to pick between the activities you want to do because you're not going to be able to do them all. And you know,
Normalizing it, you mean?
Yeah, and knowing what it is and giving it a name and identity and, you know, tools to deal with it. Like pacing is brilliant, and actually resting before and after an activity. Because as children, you don't, just because you've had a stroke, you don't stop wanting to do everything. You don't stop wanting to be with your friends and doing what they're doing. So I think it's really important just to have that little bit of understanding for the child. But as adults, I know as adults to my own like healthy children that they won't understand. They'll just, you know, you understand and you hold that in you as an adult, as a mum. But getting the child to understand has so much value, I think, and just, you know, it's okay. And there's other things, providing alternative things that you could do instead of running around in the playground and that kind of thing.
Yes, yeah. Another question we've been asked today is, how would you suggest dealing with the transition from child into teenage years, higher emotions and different social situations, and realizing that they feel different from their peers? Because Katie, you've actually been through that.
I have indeed. I didn't want to jump in and answer straight away because I didn't want to take all the questions in case anyone else had anything.
And then we'll go to Renee and Ailey, I suppose.
So I think, to be honest, the answer is going to be similar to the fact, having that identity and knowing myself and knowing that these are the issues that I might face, and that's fine, and not constantly trying to achieve what I think I spent my life trying to achieve what everybody else was achieving, and then felt very secluded. I feel like if I would have had that identity, if I'd known what I might, you know, if I'd have known the challenges I might face, I would have known how to deal with them differently. I mean, the emotions of when you're a teenager, anyway, the hormones and everything, I feel like all of that was heightened by just my lack of self-esteem, because I wasn't reaching those goals that I thought everyone else was. I was really quite low at school. I didn't think anyone was ever going to fancy me, ever. And now I know on the other side of it, I have a husband, I have 2 children. I never thought I would get there. Those were always like my main goals. And I was so caught up in the fact that I was different. And actually, I think there needs to be a general awareness that different is fine. Different is good. It's not, we shouldn't try, as teenagers, we shouldn't try and be one mold of every, you know, the same mold as everyone else. It's okay to be different and to have different limitations.
Like you said, being a teenager and having stroke symptoms on top of all that.
The wild ride, I tell you. In the end.
Does anybody else have anything to add?
Okay. I think it's really important to kind of accept yourself. And I feel like once I sort of accepted what had happened to me and I kind of was advised it's almost like the process of grief. You know, you've got to, I don't know if the child would sort of remember pre-stroke, obviously it depends how old they were, but I kind of had to sort of let go of who I was before, and, you know, the fact that I was due to be finishing my studies that year and move on from that. I kind of had to just let all of that go, like, well, this has happened. I can't do anything about that. I can't undo it. I just need to accept that and work on making the progress in my recovery, and maybe I'll get back to who I was before, maybe I won't. Like, all I can do is focus on kind of just improving, and just accepting that, yeah, like you say, there is symptoms and you're different and you can't do everything like your friends. And I think once you sort of accepted that personally, it's a lot easier. And I don't know, I found myself, I kind of stopped caring if other people didn't, because I was like, well, this is what happened and that's on you if you can't accept that. And yeah, that's your own ignorance, and that's your problem, not mine.
Yeah. And Renee, would you like to add anything?
So Ollie's transition was slightly different because he wasn't going from childhood to being a teenager, but he was going from a teenager to being an adult. And he coped with it remarkably well, better than I did. And I remember being at his first hospital appointment once he turned 18, and he asked his dad and myself to leave the room. And we were just horrified and so upset and scared what he was discussing. And I always thought it was asking about sex, but years later, his brother said to me, no, he was asking what would happen if he took drugs, you know, and he's not a drug taker, but he just wanted to know. He was planning to go to university. But there is a lot of support out there for each stage of the transition, educational support and that sort of thing. So take whatever support is available. Oliver actually, by the time he went to university, didn't want all the support that was given, because he could have had things like taxis to take him from his student accommodation to wherever the lectures were. And he didn't want to do that. He didn't want to be different to his friends. So he just was extra tired, and that's how he balanced it, and that's how he wanted it to be. But there is support there if you know where to find it. And actually, as you've been talking, Katie and Aileen, I just remembered a poem. I haven't read it for a long time, but it's called something like Welcome to Holland. I don't know if any of you know that.
No.
It was written by a lady whose child was autistic, and it was given to me by a friend who has an autistic son, but it's very relevant, and I've shared it in the Facebook group a couple of times. Have a look for it. It's called Welcome to Holland.
Right, okay.
Inspiration.
And dear, thank you very much, everybody. We haven't got any more questions. Just somebody has commented, and I think what she said is, or he has said, is very understandable, saying that if the parent, I'm sure the parent of the stroke survivor, if he gets or she gets absolutely exhausted, it makes it very difficult to cope. And yeah, I can relate to that. Well, thank you very much, everybody. I think that concludes today. As we said earlier in the webinar, we have recorded today's sessions, and it will be available in the coming weeks, hopefully a couple of weeks' time, via our website, to the YouTube area of our website. So thank you very much, and I'm just well, overwhelmed with what you've had to say today. So thank you very much, everybody, for joining us. Thank you.
Thank you for hosting.
Thank you for having me, Genise.
Yeah, you're all stars. Thank you very much.
Thank you. Thank you, everyone, for listening.